morning and welcome to our latest webinar, Back Pain, Keep It Simple, Feel Better. My name's Katharine Metters. Some of you may know me, and I'm the lead consultant at Posturite. I have a background in physiotherapy, ergonomics, and health and safety. And like most people, have experienced significant back pain in my working career. And I'm joined by John, who is a key account manager for Posturite and is also a therapist, and I will let him introduce himself when he does his first slide. So he obviously has significant experience in this area. This session will be recorded, so if you need to share it with anybody else or need to dip out and come back to it, it will be available on our website, and also it will be sent round to you in the email after the event today. We'll also be sending around some other advice and some things to signpost to as well in the email. So hopefully that takes the pressure off in case you need to do other things. Just also want to mention we've got a poll going. Please, could you answer those questions? It just helps us to know who we're talking to, and got some interesting thoughts there for you. So if you could answer that, that would be great. And finally, this is very much about back pain that many of us will struggle with. There are some types of back condition that require quite quick action. So if you have back pain, if you're suffering right now and you have problems peeing or pooing, or got pain down both legs, or sexual dysfunction, things like that, please take it seriously and please seek immediate attention. What we're talking about is everyday back pain, which is disabling and horrible, but doesn't need emergency attention. So really, that's where I want to start today. We won't be doing open Q&A. We don't have time. We're on a short timeline today, but we have combined a lot of the questions that you've sent us in advance, and we're going to be answering some of those at the end of this session. So without further ado, over to you, John.
Thank you very much. Thank you, Katharine. If we can have the first slide, please. So to briefly introduce myself, as Katharine did, thank you very much. My name's John. For anybody who doesn't know me, I'm one of the key account managers in London. I've been with Posturite for around 17 years now. And as Katharine mentioned, my background is as a sports injury therapist, and I still do some in-clinic extracurricular work, and in those clinics are alongside physiotherapists and sports therapists. So hopefully have quite a lot of experience now around these things. But what I wanted to start with was just some key bits of research that we found. Actually, I don't think these are going to come as a surprise to anybody watching here. And actually, some of them I even slightly disagree with, but I will discuss those now. The first point being that the research shows us that about 80% of adults will experience back pain throughout their lifetime. And this is actually the one that perhaps I slightly disagree with. I think it might actually be higher than that. How we define back pain might vary. But I think probably all of us sitting on this webinar now might well have had some experience of back pain. And it is also believed that at any point in time, 12 to 30% of people are suffering with back pain. So if you think of 3 to 5 friends right now, the research shows us that at least one of those is currently suffering with back pain. So the reason we led with these bits of research as we dive into more content of the webinar is that it's showing us that these things are super common. They are affecting everybody, but they are things that we can certainly put steps in place to help with and support. So next slide, please. Okay, and at this point, this is where we wanted to talk about our poll results, which we can see now. So again, actually, the first one, have you ever suffered from back pain? My suspicion of the research being incorrect and too low was supported by you guys. So thank you very much for backing me up on that one. We found that 90% of people currently here have suffered back pain, which I think is much more of an accurate reflection. So thank you for that one. And actually, the percentage of people that were diagnosed with a degenerative disc, or what might be termed degenerative disc disease, but an MRI scan, most people pluck for 41 to 60% of people above 60-year-olds. As we've seen, it's actually higher than that. And I find this a really interesting stat and research that was done. And what this showed us, these were non-symptomatic people who were put through an MRI scan. So by that, I mean people that weren't suffering with pain. But what they found was at those age brackets, an incredibly large amount of people had degenerative discs. So the reason that we list it is that we are showing that degeneration happens. All of these things are quite normal. They may even be non-problematic for a lot of people at this point, but the frustrating thing is that at any given point, sometimes they can become problematic. So the reason that we list these stats, and even by 20 years old, 37% of people were showing degeneration of these discs, which we'll come on and talk about in a short while about what these discs actually are. But really interesting to see how many people are affected by these conditions. So the overall point here is that back pain is completely normal. We all, to a certain extent, will suffer with it. But what we want to talk about now is what we can actually do about it, how we can make sure it doesn't have to become the big problem that perhaps people perceive it to be, and how we can support people in and out of the workplace. So back pain is normal as we move on to our next slide, please. So what we wanted to do right at the start was just talk about some of the key terms that you might have heard, terms that you might understand, or what we often find are perhaps people have heard these terms but not quite understanding exactly what they are. So we just wanted to really quickly explain some of these. Firstly, the lumbar spine, probably the most affected part of the spine. It might be a term that you're familiar with, but the spine is broken up into sections, as you can see on the image here. So we have the cervical spine at the top. So if we think of that as being the neck, the thoracic spine being the upper back, then this lumbar spine, which is the lower part of the spine. And then we have the sacrum, which is the bottom part of our spine with things like the coccyx. But also I mentioned about discs. A brief bit of anatomy of the spine is that in between each of these bones or vertebrae, we have a disc. If you think of a disc, I often describe it as thinking of it like a jam donut, where we have a round circular structure. And inside of that, there is some fluid. Now, these discs are there to create shock absorption, separate those vertebrae, very, very helpful structures. But what we do find, as we've mentioned in the previous slides, is that these can degenerate over time. But yeah, there we see the lumbar spine at the bottom there, and it has this natural curve to it. That's what we call the lordotic curve or the lordosis that happens, and that is required. That is helpful. We would prefer to have that curve than flat spine, but sometimes people can have an excessive curve. So people might mention that they have a particularly lordotic curve. All that means is that they have an exaggerated curve in the spine, and this can affect posture and things a little bit. But again, emphasizing that this is quite normal to have this curve. If this is mentioned, it's not something that instantly creates us to cause panic. If we have excessive lordosis, it's all quite normal and seen throughout the population. Then we come on to talking a little bit more about these discs, and you might have been familiar with a term that I personally don't like, which is a slip disc. I think it creates the wrong impression as to what's happening to the disc, but you might have also heard herniated or prolapse. So just to briefly mention those, that the discs are there, as I mentioned, sitting in between the vertebrae, and they're there to create those shock absorptions. But what those discs can do, and as we found commonly do in the earlier research, is that they can bulge. So I mentioned about this jam donut analogy. If we imagine that the jam inside of the donut pushes at the outer surface of that donut, and that can create a bulge. So as I mentioned, that is commonly happening, but it can become problematic if this bulge starts to impact on some of the nerves that come out of that spine. So through the middle of the spine that you can see there, we have the spinal cord, and branching off of that are all the nerves that run and innervate all of the muscles around our body. So if these bulges frustratingly start to impact those nerves as they come out of that spine, then that's when we can start to see more problematic symptoms happening. And that leads me into the term sciatica. So sciatica, again, is a kind of a blanket term where we're getting any impact on that sciatic nerve. So the sciatic nerve starts in the lumbar spine and it runs down to innervate the legs. Now, if we get any bulging that starts to impact on that nerve, that can cause this sciatica that we might have termed. But that can happen because muscles impact on that nerve. That can happen because discs impact on those nerves. Lots of things can cause sciatica, and it can affect us anywhere from the pelvis right down to the foot. Typical symptoms might be tingling, pins and needles like sensations, perhaps burning or altered sensation, lack of feeling. They're your typical kind of sciatica conditions, and unfortunately a common condition. And then finally, as I mentioned, degenerative disc disease is when these discs, the fluid inside the disc, can become dehydrated, and we can start to see degeneration or damage to those discs. So again, frustrating condition to have, but unfortunately, a frustrating part of life is that as we age, we see signs of degeneration. And the research earlier showed us that by the time we're getting towards 60, it's incredibly common to have some of these evidence of degeneration at the discs. Next slide, please.
Yes, I think that comes on to me now, John. Actually, one thing I just wanted to add to that when you were going through the anatomy was sort of saying, obviously, the body reacts, doesn't it, to the pain, and quite often it's the reaction, the muscle spasm, that then makes it actually worse, doesn't it? Because it tightens everything up and puts more pressure on it. So a lot of the things that we will be talking about is trying to get everything working back normally and trying to realign things so that actually things have the space to work and the swelling comes down. So that's really where I come in to start talking about some of the things that we say we need to do. I just also want to go back and say, we do say that unfortunately back pain is normal. And that's so easy for us to say. But, when you're lying there in pain, and I do remember lying on my landing in pain, realizing that I wasn't going to do what I was going to do when my back went. Trying to think of these steps to recovery was really hard. So I don't want to, by us saying it's normal, I don't want us to dismiss it because we know how awful it is when you get it. So, but it is so important to put these small steps into place to allow the body to heal and regenerate. So the first thing on my list is keep moving. And I know that's probably the last thing people want to do, but we're not talking go to the gym. We're talking just keep gentle movements going, gentle walking, lying on the floor. We'll give you some signposting to some exercises, gentle rotation with your knees bent, things like that will start the process off. So you need to keep moving. For most people, sitting is the most difficult thing. So if you're in acute pain, try and reduce your sitting. But if you are sitting, you want to make sure you've got good support so your body is able to relax as much as possible. Keeping your pain under control is absolutely vital because we want you to move, and you're not going to do that if you're in pain. So if you do have painkillers that you can take, I would strongly advise using them to control your pain. But heat and cold can be so important. I'm a big fan of ice. I hate using it myself, but I find it incredibly effective. You know, um, 10 minutes with an ice pack can really help to release some of that spasm and the tension and reduce the pain and allow you to breathe. So a good ice pack is invaluable. But I appreciate some people really can't deal with that. And with older, more long-term back discomfort, back pain, actually maybe a heat pack works well for you. So, don't be too worried if you really cannot manage the cold. Making sure when you do rest, you're in a supported position, and that be whether you're in bed, lying down, or whether you're sitting. Try to give the body the much break as it can so that it can get on and heal. And take the time to discover your best pain-free positions. And I know that sounds really odd, but lying down, try putting one leg over, try supporting one leg, lying on your front. It's really important if you can find a position that your pain is less. It's quite reassuring for you. So you can get on and do some exercise, do some movement, and then come back to a period to relax and let your body rest. So it's really worthwhile spending some time working out what makes things worse for your back and what makes it better. And if you do go and see a physio or another therapist, having that conversation will also help them understand what exactly is going on as well. Next slide, please. So I've gone on about the importance of movement. We know it's vital. It's important to release the tension, increase the circulation, get the body's own natural pain relieving chemicals to the place where they're needed. We are designed to move. We're designed so that our muscles bend and flex. And if we don't move them for a while we're in pain, our recovery is going to be reduced. So it's really important to keep the rest of the body going. And our research is pretty much telling us that, when we should be moving at least every 30 minutes. So it's little and often. That's what we want to do. And if we are at work, that will also help our productivity. So it's good long term. So it's a good way to prevent back pain. It's a good way to increase our productivity. And it's a good way to help us recover if we are struggling as well. It's not only just good for our bodies as well, can I just mention it's good for our eyes and it's very good for our brains too. So very, very important that. Can I have the next slide, please?
I think that hands over to me to talk a little bit about workstation setup. Probably not a surprise for Posturite to be talking about the importance of good workstation setup. But before we dive into that, actually, we do always like to say, and I always say it's a slightly cheesy phrase, but one I think rings true, is that the best posture is the next posture. And it really supports what you were just saying, Katharine, about the importance of movement. One of the phrases I tend to hear around back pain is that my back went or my back's gone. And actually, it's what does that actually mean? When somebody's back went or back gone, typically that might be around something like a muscle spasm. And as I always explain to people, a spasm is there actually to be helpful. Whilst painful, it's helpful. It's your body identifying that there's been some damage and it's stopping you use it further. So it's almost our body's protective mechanism to say that there's a issue and it wants to deal with that. But then really pain becomes about a communication between the body and the brain. So the importance of movement is then our body telling our brain that we are now okay to start slowly moving. And that's why, as much as we're going to talk about the importance of good posture, we always want to re-emphasize that when you're working with people with back pain, to find those appropriate movements that they can do. Those pain-free movements are the thing that is going to be sending those appropriate messages up to the brain to say we're on the road to recovery. But what we do know is that we are going to spend a lot of time at our workstation. And as a result, there's important steps that we can put in place to give people the right cues. Unfortunately, back pain isn't something that typically we suffer, where as soon as we sit at a poorly set up workstation, we get back pain. It happens as an accumulative thing and it builds up over time. So putting these cues in place for people could be really helpful. And it's amazing the amount of people that we see suffering with back pain and they don't have these things in place. And these small tweaks can make a huge difference. So, for example, making sure that they're sitting with their hips above the knees. We spoke about the lordotic curve earlier in the webinar, and what this does is it looks to reinforce that lumbar position. So it looks to take the pressure away. The reason that we have that lordotic curve in the first place is to provide the appropriate support for our back. So putting our hip above the knee joint, so that can either be done simply by raising the height of the chair or by tilting the chair forwards, will put that spine into a better position. But what we always talk about is making sure that the chair is set first. So many times I'll see a workstation where somebody says, well, I know that my eye line should be at this point on the screen, so I pop my chair down to make sure that was in the right height. But actually, we want to reverse that. So if we're working with people with back pain, first thing we do is probably reinforce movement and find out what they can do. But secondly is make sure that that chair is set correctly. Everything else can come afterwards. We can change the seat height. We can bring the floor to them if required by using something like a footrest. We can then move the keyboard and mouse into the appropriate position. But we want to get the chair set correctly with the hips above the knees and the shoulders relaxed at the workstation. The amount of time I say to people, like, sit with your shoulders like this for me while we're chatting. Now I'm going to leave you there for 7 hours. Would you expect to have some upper back pain? Yes, you would. But when we're doing it with our keyboard and mouse because our chair's inappropriately set, then actually we don't think of it in that manner. So putting these cues in place from the start is going to be really helpful. Next slide, please, Tom. Okay, so what we're really looking to do here is to try and support you in how you can help people suffering with back pain, because it can be difficult, particularly if you're working with somebody who's in a lot of pain. We all know that when we're in pain, it's perhaps not the most positive time in our life. We're not the most optimistic of people when we're suffering with pain. But what we can do is look to set some objective markers for people. And I think the importance of goal setting and highlighting to people their improvements is so important because it can be easily forgotten. So a skill that we have as therapists, but also as DSE assessors, are highlighting perhaps some of the important benchmarks that people can work to. So these might be things like a pain score. How would you describe your pain out of 10? 10 being the worst and 1 being a small amount of pain. And we can track that score. And hopefully when we put these changes that we're talking about in place, we see that score coming down, because people might forget that now they're at a 3 or 4. They were once at an 8 or a 9. Or how long can they actually work without pain? When does your pain kick in the day? Can we extend that duration? Because then we know that those things are improving. And when people see improvement, that increases the compliance to their rehab, and that will continue and actually expedite those improvements. Another thing, we've spoken about movement. So a great goal to set people is, how far can you walk? Have you got up and had a walk at lunchtime? Was that pain-free? Or how long did it take before the pain came in? And again, if we can actually track and document those things, it's a great way of displaying the improvements that you can make. So as assessors, as people working with people with back pain, I think having that skill of being able to identify objective goals for people is really important to demonstrate that progress.
John, it's probably useful to say here actually that the majority, I think, isn't it something like 95% of back pain resolves within 12 weeks?
Yeah, yeah,
Now
yes,
that's easy
exactly.
to say, but 12 weeks is a long period of time. And so again, having these goals helps you see how you're progressing along to that point. And it's important that we, give help and reassure ourselves, isn't it? Because it's always a
Exactly.
difficult time.
Yeah. No, exactly.
Right.
Very important.
I think next slide, please, because we're going to be going on to the questions. We had a lot of questions in advance, and so John and I went through them and tried to sort of group some of them of the most common ones together. So I hope that we'll be able to answer some of the ones that you've got. So could we have the next slide, please? So the first one we picked out was, is a sit-stand desk always necessary? Now,
Well,
my viewpoint is it's really important to be able to move between sitting and standing if you're going to be working. And I think actually work is very helpful in back pain recovery because it's a good distraction too. So I think it's good, but I think there are other ways you can work, sit, stand. So I don't think that it's always necessary, but I think being able to stand and do things is almost necessary. John, have you got anything you want
no,
to add to that?
I agree. I think to reinforce the points that we've earlier made, what we would say is necessary is movement. And I think that sit stand desk is probably a vehicle that allows a change in posture, but it's not the only means that we can do that. So when we're taking phone calls, can we stand up and have a wander around the office or home now? Or even can we schedule in things like walk and talk meetings if we're having internal meetings where we know that actually we would just sit and engage in that typically, but it doesn't need us to be sat at the workstation. Can we use that time? So whilst I think that they are helpful, I think really it's about analyzing how regularly you can change your posture throughout the day and working to that 30-minute guidance. So a sit stand desk is a great way of doing that, but by no means the only way. And even with a sit stand desk, it shouldn't be the sole solution to providing movement, in my opinion.
Oh, absolutely. And I think people who suddenly say, "Oh, well, I'm going to stand all day," oh, that's a recipe for overload for those tissues that are really trying to recover. So I think there's also, you can purchase a filing cabinet. I mean,
Yeah.
I've had people who've used ironing boards at home, obviously get somebody else to put it up for you. High work surfaces. There are lots of places you can lodge and use as a high work area or just a perch area sometimes. So I think we can often be inventive. I think necessity is the driver of invention, isn't it, or something like that. There's a phrase like that. Can we have the next slide, please? So, what daily measures can somebody apply to avoid back strain pain? For instance, are there daily exercises to maintain suppleness? Oh, I'll let John. Do you want to leap in there to start off with while I get my
Yeah.
teeth back in?
I would say yes, definitely. I think we've already emphasized how important the movement is, but in terms of daily exercises, we know that muscles are designed to shorten and lengthen. That was how we were designed to move around. So yes, by creating that movement, that's going to be helpful. So there are various stretches that can be done. I think I would at this point signpost perhaps to our website, and perhaps we can circulate this as well, because we do have various infographics and things that display some of the stretches that can be available to you. And we know that there's key areas to target. So yes, we're discussing back pain today. So having lower and upper back stretches are going to be helpful at the workstation, but we also know things like forearm stretches are going to be important as well because of the input devices that we're using. So yes, there certainly are stretches that can be put in place. And as I said, feel free to check out our website, looking at the resources section where there's some great infographics around some of those stretches rather than us going through each of them individually now. But yes, and in terms of the measures, I would very much signpost towards the 30-minute guidance as well to try and make sure that we're having some movement for reasons that we've discussed earlier on. But Katharine, I don't know if there's anything your views on that one.
Yeah, I think there's also, I mean, the Chartered Society of Physio has some good resources on their website. There's quite a lot of people who have some very good things. In terms, I'm often asked, well, how do I know that I'm not going to overdo things another? I mean, my advice is you should always exercise within your pain. That doesn't mean to say it shouldn't be uncomfortable. Sometimes when you're stretching something, it is quite uncomfortable, but there is a difference between pain and discomfort. And it's important that you listen to your body. And a little bit of discomfort is sometimes fine, but pushing into pain is not. So it's really important when you're doing exercises, particularly when recovering, just to keep that little idea in your mind. Discomfort may be fine, pain bring back from what you're doing and do things slowly when you're in pain. So you've got that control and you're not going to cause a problem. So you shouldn't be fearful if you stick to those guidelines. Right, next slide, please. So, when to offer adjustments and when to get professional advice. There seems to be an element of fear sometimes of helping people with their workstation and with some advice that we might make it worse. So, John, is there anything you want to start off on that one?
Yeah, I think it's a really great question, because I think sometimes when we hear certain terms or certain terminology, it perhaps worries us as DSE assessors. So some of the terms that we used earlier might seem frightening. But what I wanted to reinforce really is that our role as DSE assessors, we shouldn't understate the importance and how much we can help, even if it's going to lead to professional advice then coming into place further along. So I almost link it a bit like first aid in the sense that, we know when we're administering first aid that there might be the need for further care, but the importance of first aid can be vital. And it's the same when we're dealing with somebody with back pain. Even if they're going to need a professional assessment from people with additional skills, we can really be helpful in that time, because that will take a period of time. There will be an element of getting an assessment arranged and an assessor conducting the assessment. And then if there are extra interventions, then coming into place. So still, please don't sort of understate the importance that you can provide by giving these postural advice, these movement advice, these factors that can start people on their journey to recovery. And it might be that they don't actually need that further professional advice because those small fundamental changes can make the difference. But I believe that even if they do need that professional advice, I don't think we need to think of this as a one or another, but rather a holistic approach where the importance as initial DSE advice can have is fundamental.
Yeah, I think it also, you may well your advice to the proper setup may actually, stop them having problems in the future too. So it might be preventative for another bout. So absolutely, but leave the sort of the clinical sides to the clinicians. But as far as workstation advice and good advice about taking breaks, it's never going to be contraindicated. Just get the good advice in place for their workstation and plenty of breaks whilst they're working. Next slide, please. Next question. Oh, this is, if poor posture leads to pain, is there anything that can help? Oh, well, I mean, I'll start this. Well, obviously, let's improve the posture. So those poor tissues that are feeling discomfort, which is causing the pain. So actually, first of all, identifying what it is about the posture that's causing the pain. Is your screen over to one side so you're twisting? Instantaneously. I mean, I've moved people's workstations around, changed the working position, and they go, "Wow, that's automatically feels better." So first and foremost, if it is a postural problem, trying to improve what's creating that posture can be helpful. Not always possible. It may not be a setup thing, but if it is a setup thing, which for many of us it is, changing that can make a huge difference. As far as people say I've got poor posture, or as a therapist, I've looked at people and thought, oh gosh, their posture's poor. It's difficult changing your posture, but I would say it is worth trying. It will take 6 weeks minimum, but even every small step to an improved posture will reduce the strain on the tissues to try and maintain a poor posture. So, John, do you want maybe some other wise words there
Well,
from you.
I'm not sure if I could provide those, Catherine, but I essentially agree. I think when it comes to posture, yes, hopefully we can help. I think the key thing with posture is that it isn't going to happen overnight. It's not going to be an instant fix. But also, I find it frustrating when I work with people who blame posture and believe that it can't be corrected. So, actually, if something about the setup has caused these changes in posture, unfortunately, that's only going to exaggerate those negative impacts of the posture as things go forward. So yes, we certainly, if we believe that posture is causing the pain, we want to analyze all of the things that we can in our control. As Katharine mentioned, it may well be things that are outside of the workplace or outside the environment that we share with the person we're working with. But if we can make those changes and again set some of those objective markers, let's see if we that make those changes and then we start to see some improvements in some of those markers, then we know that we are making positive changes. And as Katharine mentioned earlier, what we're also doing, hopefully, we do know frustratingly that back pain can reoccur. So if once we get over this bout of back pain, we're then putting in good habits to reduce the likelihood of it reoccurring. And if it does, certainly we'll be reducing the severity that it reoccurs with. So yes, I certainly, in essence, yes, I believe there are things we can do to help.
Do you know, I'm conscious of time, but I just want to share a couple of things. I've had a number of patients over the years who I found actually that some of their posture has been caused by where their television is in their sitting room. They say, well, yes, it's up high and to my right. And it makes perfect sense. So just remember that, our life according to back pain is our whole life. And we need to look at everything we do. And sometimes it's what's going on at home is not helping either. So just think about your body likes to be symmetrical and think about things you do for periods of time at home and just make sure that things are in the right place for you. And that you're not sat, and sometimes in a room it can be difficult. Your sofa's here and your television's here, and so do just be mindful of what else is going on because sometimes it's the little things that can build and create poor postures because posture is only the result of our ongoing life. That's what it is. For some people, actually, just walking high and looking forwards rather than looking down at your feet can make a big difference when you walk. So it's often just a few of the little things. Can we have the next slide, please, Tom? A good one to finish on, I think, actually, John. What should I do if I have acute back pain? Never very cute, but when sudden onset back pain, what should we be doing?
Yeah, I mean, again, validating your point earlier, Katharine, I am a big fan of ice. Particularly in the acute environment. I think that when people speak to me about pain, one of their concerns is, should I use hot or should I use cold? And quite commonly, these two can be used in conjunction. But I always say that I don't think you can go far wrong with ice. I think it's a nice natural painkiller. It's a nice natural way of bringing down inflammation. So if you have an acute and by acute, we mean a kind of sudden advanced onset of pain in that area, then I always think that ice for those 10-minute periods that you mentioned, Katharine, earlier, is a very helpful way to start. Then the other point to reinforce that you said earlier is as quickly as possible, it's about finding the movement that you can do rather than fixating on what we now can't do because of that back pain. Let's switch that mindset and say, right, what movement can we do? And these might be lying down, but slowly moving our legs to side or up and down, or trying to just find those movements that you can do because we know long term that's going to be helping us out. And that is the same for stretches. Like you said, Katharine, there is a distinct difference between discomfort and pain. And we want to be able to sort of find that distinction and move into discomfort without crossing the border into pain. So light stretching, light movement that we can gradually increase as the severity of the acute nature starts to settle, I think is going to be very helpful. And then we can start to bring in things like heat treatment once we've had the pain for a little longer. And if we feel things like muscle spasms in the surrounding area, then that can be helpful to loosen out those structures. And again, like Katharine mentioned earlier, not being afraid to use painkillers in the early stages, because if that supports us to do the things like the movement and the exercises that we know are going to be so key as we move further in the rehab journey, then I see that as a good thing in the acute stage. Over to you, Katharine.
Yeah, I do remember one of my patients telling me that the best thing they found for their back pain was a bag of frozen Brussels sprouts because they said the knobbliness of the Brussels sprouts allowed them to massage it. So each to their own, but so frozen peas, Brussels sprouts, frozen sweet corn. But obviously, if you defrost it please don't eat it afterwards. But I do think it can be incredibly helpful if you can just get over that first few minutes of discomfort, and then it really just makes a big difference. But yes, for me, it's keeping it cool, keeping it supported, gently moving, and so just sometimes actually a few deep breaths isn't a bad idea. Just literally concentrate on just relaxing and letting the body heal, because ultimately it is the body that will heal itself, and our job is to give it the environment in which it can heal. That's really thing. Now, I'm afraid, John, we are slightly over, but I don't think we can do much more today. I just want to thank everyone for listening, and I hope we've managed to provide some help. We will be sending out an email afterwards, as I say, and give you some tips and some websites and some links and that sort of thing. I do believe also we're going to do a 25% discount code for some of our back care products. So if you've taken the time to listen to us, you may find that helpful. I think just leaves me to thank John for all his help in helping me put this together for today. And just to say that we've got another webinar on the 18th of June. Fascinating topic about return to work after serious illness. And we've got some people who've done that, who will be explaining about their journeys and their top tips. So that could be a really interesting webinar for some people. So I think apart from that, John, anything else from you?
No, thank you everybody for their time. So
You
much
can
appreciated.
get on with our day. So thank you very much, and we'll see you next time. Thank you.
Thank you
Goodbye.
all. Bye bye.